So during this section of the presentation, we're going to discuss how to pay for care. As we all hear and know, Alzheimer's disease and related dementias are very costly illnesses, and many families worry about how they're going to meet these expenses. So I'll review several different options that can help with paying for care. First, though, I like to talk about Medicare, which really only covers acute care and skilled care needs. So most people with Alzheimer's disease or a related dementia need assistance with personal care and supervision, which is not covered by Medicare. Medicare supplements and Advantage plans are based on Medicare coverage and also do not cover long-term care needs. Long-term care insurance is one option to help pay for care. It can be very helpful if this is in place before a diagnosis of a dementia. It's very difficult to purchase as people age and have chronic illnesses. Also, the cost significantly increases with age. When in place, it's typically activated with a diagnosis of a cognitive impairment. Services may include in-home care, adult day health care, and placement in a residential setting. As all policies are very different, it's important to be aware of what is covered in a specific policy and review it before services are needed. VA aid and attendance is another option that may be helpful for paying for long-term care needs. This is a monthly cash benefit for veterans or surviving spouses who require care on a daily basis. It's for veterans who have served 90 days of active duty with 1 day during a period of war. And most of the wars that we see people eligible for this benefit were either World War II, the Korean conflict, or Vietnam. And be aware that the veteran did not have to be at the war site. They could have been in the service stateside or in another country, but basically it's the time frame. Financial criteria focuses on having only enough savings to pay for care for 1 year. One house and one vehicle are not counted as financial criteria. Payment is based on unreimbursed medical expenses compared to household income. So what does that mean? It means that if the cost of care is more than the veteran's income, then the veteran would get the entire benefit. Application can be made at the local VA regional office, and be aware that it can take up to 1 year for a determination to be made. I always stress consider Googling aid and attendance, as there are numerous veteran advocacy websites that can explain this benefit, give you helpful information, and even help you do a practice application. The last program that I'd like to discuss is Arizona Long-Term Care, or ALTEX. This is the long-term Medicaid program in Arizona. And please note that in Arizona, Medicaid is called ACCESS, Arizona Healthcare Cost Containment System. So coverage under ALTEX includes care in residential care facilities and community-based services such as in-home care or an adult day health center. To apply, a person must be a citizen or a qualified immigrant, they must have a social security number, and they must be an Arizona resident. Being an Arizona resident for ALTEX means that that person is in Arizona. They're an Arizona resident the first day they're here. And also be aware that there is no reciprocity between other Medicaid programs. So if a person was on a Medicaid long-term care program in another state, they have to reapply once they enter Arizona. So to qualify for this program, a person has to be financially and medically eligible, and I will go over those criteria for you. First, for ALTEX financial eligibility, income and resources are both considered. Income limits are usually raised every year. So very generally, a single applicant's income can be about $2,000. For couples, The applicant's income only can be considered if it's under the income limit or the couple's income is combined and divided in half. If the applicant's income is over the limit, establishing an income-only or a Miller's trust can help to resolve this. And most elder attorneys that are familiar with All-Tax will know how to accomplish this. So for current information on the income limits and the Miller's Trust, go to this website for the most updated information. Resources are the second area of consideration for financial eligibility, and resources include bank accounts, stocks, bonds, certificates of deposit, IRAs, the cash value of life insurance policies, and property that the applicant is not living in. Resources that are not counted include the applicant's primary residence, unless it's in a trust, one vehicle, prepaid funeral plans, $1,500 designated for a funeral, and personal belongings. So be aware that if you have very valuable paintings or jewelry, they will not count that. For a single person, it's very straightforward. The resource limit is $2,000. All funds have to be spent down to that amount. However, for a couple, there's a community spouse resource deduction that protects some of the couple's shared assets for the well spouse. And this is very important to keep in mind because some spouses feel they have to spend all their savings and have nothing left for them. And a number of years ago, the federal government put this into place to protect some of the assets for the spouse that does not need care. For the community spouse resource deduction, the well spouse is allowed to keep half of the couple's shared assets within certain limitations. Application for this is made when the person needs care on a daily basis. The well spouse then needs to spend the applicant's resources down to $2,000 for eligibility. And in general, again, because these figures change every year, the well spouse can generally keep between approximately $20,000 and $100,000. And again, the website noted can be very helpful in learning about this program and the current resource limits. In addition to qualifying financially for All-Tax, an applicant must also qualify medically. This is accomplished during a medical interview by either a nurse or a social worker called the pre-admission screen or the PASS. This reviews assistance with activities of daily living, such as bathing or dressing, medication management, mobility, safety concerns, incontinence, such as bowel or bladder accidents, having a cognitive impairment, and behaviors, such as wandering or aggression. Family members must be present during this interview to provide accurate information. Most people with Alzheimer's disease have changes in judgment and understanding, so they may think they're doing things that they really aren't. We recommend that it's very, very important to prepare in advance for this interview. It's helpful to have medical records stating the current diagnosis of Alzheimer's disease or related dementia. It helps to begin making a list of all the dependent needs and safety concerns and/or behaviors that the applicant has exhibited, repeatedly or occasionally. The focus is on looking at the person's worst day. This is not when you want to make them look good or focus on their strengths. You really want to look at their dependency needs. It's very important to be successful with this end of the application. There are some other considerations that are helpful to be aware of when you're applying for All-Tax. The program does look 5 years back on transfers of funds or assets, and if that occurs, there can be a penalty at the time of eligibility. Applicants also will choose one of several All-Tax health plans. Once eligible, a case manager is assigned from the health plan to set up specific services that are necessary. Applications are started by calling the local county office. In Maricopa County, the numbers are on the screen. If you live in another county, visit the website on the screen to obtain the number for your local office.